We do that all the time, actually. The first session is usually, in addition to all the therapeutic goals that you have, on a logistical and practical level as a provider, from our point of view, it's a dose finding session. So you may titrate the dose up or down after that to make the experience more or less intense. Sometimes you want a lower dose because the person wants to have a trip, but they want to feel a little more in control or oriented. And sometimes you deepen the dose because they want to go a little deeper or you think they should. And so that's a collaborative decision, but yeah, we do that all the time. There's not one particular dose that's best for all people. So the first dose is kind of like, we have a standard dose we start people on, and then we go up or down. And some people, you will do both. Like some people, you decide, hey, it would be, our goals for this next one are to have a more intense experience. And then maybe the third time, our goal is to lighten it quite a lot and have a light experience with a lot more give and take, a lot more conversation happening with a milder psychedelic state so that we can converse and we can figure out some stuff and we can dialogue while you're under that state and so on. So that's a moving target with the dose. There's a huge amount of variety on what doses can be chosen depending on what the goals are. Yes, on average, that's true. It's not true that you don't talk to people on higher doses, but you talk in a different way. And this is sometimes where the training is really important. With someone on a light dose, you can talk a lot, like you and I are talking, but you know that they're not receiving what you're saying the same way. They're not perceiving things the same way. And this is where having an experience yourself or multiple experiences yourself is critical if you're training to be a therapist, right? You need to experience these doses yourself so you can get it. So lighter doses, on average, there's more give and take happening with the therapist. On heavier doses, you're more holding what's called, the idea of holding space. You probably heard that expression. Sitting with them in a safe and reassuring way. And there's less conversation, but we do prompt people. We do prompt people partly to bring them back to an intention if they asked us to do that, and that's part of our goal. Another reason you would prompt is so that you can understand what's going on with them so that you can take notes because they're not going to be able to on the high doses. So a lot of times people will have really profound experiences on high doses that they're not able to verbalize it, right? Because the higher the dose goes, the less interactive you become. And so you're trying to find that balance between the high, the intense or psychedelic experience where they're really, out of body, or having like oftentimes people have experiences that are kind of like near-death experiences where they feel like they're having an afterlife experience where they're in another realm or another place and they're really not present with you in a lot of ways. When they're having those experiences, they can describe where they are, they can describe what's happening, and they often need to be prompted to do that, and then they can. And that's valuable because then you know what's going on with them, but also you're able to document that for them, because one of the downsides of the higher doses is you don't remember it as well afterwards. So the therapist at that point is also serving as sort of a recorder, prompting the person to speak more so that they can document the experience in case they don't remember it as clearly as they would like to. So that's a little bit of a difference. So depending on the dose, your role as a therapist is different, and the combination of roles you have, I'll say, is different. On a very light dose, the person's going to remember everything, just like you and I, this conversation you and I are having. But they're going to be talking, their brain is going to be different in the conversation. They're going to know their brain is different, and they're going to be making different kinds of connections than they normally would, or seeing things differently. But their memory, their awareness of that they're sitting there and talking to, and their memory is totally fine. They're going to remember it all. And then you can just talk about it the next day, right? So when you're at a higher dose, their memory is going to be less reliable, and you're doing a little more memory job. So it's a little bit of a dance, and but yeah, I think that answers your question. The doses vary a lot.